We have Sumit Gupta with us. Hi, Sumit Gupta. How are you?
Fine, sir. Good afternoon, sir.
Good afternoon. Please introduce
Sir,
yourself.
I have
Briefly.
actually sent a message to you, and you told me that my mother is a C-peptide is 0.56. And
You message this, right?
yeah, sir, I have messaged that. And sir, she is following already HB DIAAFIT diet, and her HB1C is 8.2.
Hmm.
And sir,
So
I have contacted your team also. They have given the list of tests that I have
uh,
already carried out, and after getting that test, I came to know that HbA1c is 8.2 and C-peptide is 0.56. Now,
so
sir,
her
I want
body is not producing enough insulin. Is she
sir,
taking any insulin right now?
no, sir, she is not taking any insulin, but she is taking medicine as metformin, sitagliptin,
Medicine will
like that.
not help. If medicine will
Sir,
not help, please consult your doctor.
sir,
Didn't your doctor give any insulin injections?
sir, she has taken only 2 or 3 times insulin injection, but after taking insulin injection, her glucose level is goes down, sir.
No, then reduce the dosage, na? Reduce
Okay,
the
sir.
dosage. See,
Sir,
you need to understand her body is not producing enough insulin. When I'm
right,
saying
sir.
enough insulin means I'm not saying not producing at all insulin. I didn't say that. Okay. Her body is producing insulin, but not enough insulin.
Right,
Okay.
sir.
So in that case, outside insulin is required.
Sir,
Okay, because HB1C is very high. Now that you are following diafit diet, which is based on a low carb diet, moderate protein, moderate fat. Okay, so when you
sir.
consume diafit diet, then the requirement of insulin dosage comes down.
Right, sir.
Clear? So your
Mm,
doctor has given insulin injections based on what normal people eat.
right, sir.
Okay, and normal
Sir,
people eat 70 to 80% of carbohydrate.
right, sir.
Because your doctor knows that most of the people in India eat 70 to 80% of carbohydrate. So, based on that, he gave you the dosage of insulin, whatever it is. Now, since
Sir,
you have started following diet diet, which is based on a low carb diet, so
sir,
the insulin amount which your doctor has prescribed is quite high. So, you
sir.
need to bring down the insulin dosage so that she does not go into hypoglycemia. Clear?
Right, sir. Sir, she was
So
taking only 10
diet,
units.
diet diet also works for type 1 diabetes, for people whose body is not producing insulin. You will take less insulin. So it works for even type 1, LADA, MODI, all cases. But
Sir.
in those cases, diabetes reversal is not possible. The
So, sir,
moment
my
she
mother,
will eat extra carbohydrate, her sugar level will shoot up.
sir, I want to know my mother is a type 1 diabetes.
Initially, I think she was type 2, but slowly, for how long she was diabetic?
Sir, it has detected last 4 years. Otherwise, she
Four.
has problem frequent urination in night, in day also,
Ah, so it
and
could,
his
and how old is she?
she is a 55-year-old, sir.
55. So it could be LADA also. It could be
Yes, sir.
LADA.
Madam.
Huh.
So, sir,
Okay,
how
not
to, sir?
necessary, it will be type 1.
Okay, sir. Then
Okay, so in
definitely,
this
sir.
case also, insulin is required. Okay,
Sir,
if medicine is required, insulin
sir.
dosage needs to be adjusted.
Sir, how
Consult your
to
doctor.
diagnose that she is suffering from LADA, sir? That I have already seen your video, sir.
See,
But the
LADA
LADA
is,
is
see,
complicated
basically,
for me, sir. Understand?
when C-peptide is below normal range, the normal range is 0.8. Okay, when
Sir,
it is below that, usually it comes under LADA only, because in type 1 diabetes, mostly the C-peptide is very low or zero or
sir,
0.1, 0.2. Her body is producing insulin 0.5. Okay, she is 55 years old.
sir.
So LADA means latent autoimmune diabetes of the adult. latent autoimmune diabetes of the adult. So it is a autoimmune disorder. It can happen to any adult person anytime. Not necessary that I don't have LADA now and I'll never have LADA. It doesn't happen like that. I can have LADA after 5 years, after 10 years also.
Right, sir.
Okay.
Sir, then how I should know that my mother is exactly suffering from LADA? That you
Because
have told
because
that
her
it is
because her C-peptide is below normal limit, and it is
right,
not
sir.
zero. And it is not zero.
Not zero. Okay. If
And she
it
is
were
55
zero,
years old. And she is 55 years old.
right, sir.
Okay, so these
My
are the
doctor has
things which
suggested that she is type 2 diabetes, but I was just I have gone through all your videos, type 1 diabetes, type 2 diabetes. When I uh, tested
type
for
2
C,
diabetic patient will never have C-peptide below zero point 0.8 or zero point
okay.
0.7.
Then sir, for diagnosis of LADA, I can book a consultation
This
to online.
now you can now whether this is a LADA case or not, you can confirm it. Another way to confirm it, this report might be wrong also. This report might
Right,
be wrong, so get another test done. Okay, but this report cannot be wrong because you told me that her weight is 31 kgs and she is not able to increase her weight. So these are the clinical expertise which is required from a doctor, by which it's not just about the investigation, it is also about clinical expertise, other details by which we can diagnose. That's why a good doctor is a person who can diagnose properly. Anybody can prescribe medicine, right? If I tell you it is a type 2 diabetes, you can go and search and find out 10 different drug names and you can take it yourself, right? That doesn't mean you became a doctor, right? That doesn't mean you became a doctor just by googling it, that 10 different names of. You need to understand what how to diagnose. After diagnosing, then you need to understand how the drugs, it what is the mechanism of action, what is the interaction, whether it is suitable for every individual or not. There are 100 different things which you need to know before prescribing a medicine. Otherwise
sir.
everybody can become a doctor just by googling. It doesn't happen like that, na?
Right,
Correct.
sir. Sir, one more thing I want to know that by booking online consultation with you, you can already can help in this regard and give advice
Yes.
whatever is required.
Please, I'll give you advice. Please book an online consultation. I take online consultation. Here below is the number where I
Sir.
see all the reports. Okay, we have a conversation after seeing the reports.
Sir, one more last question is my last question is that I have tested HbA1c in January. It was 6.5, means just near to
Who's
pre-diabetic
yours?
because of your DIAAFIT diet from last
Uh,
1 year.
whose
Before
HB1C 6.5? Yours.
6.5 by following DIAAFIT diet.
Okay. Earlier it was how much?
Earlier it was 7.9, sir.
Yours. Your
My mother's.
oh, your mother. Okay. Now it is 6.5.
No, sir. Actually, initially when it was diagnosed, she was diagnosed with diabetic. It was 7.9. When I
Okay.
googled on YouTube and Google, I found that you are the best doctor and giving us good advice to all people. Then I
Hmm.
follow the diet and my mother follows and I also follow that diet.
Hmm.
Then I found that her HbA1c goes down by 6.5, and I was
Hmm.
very happy that just he is entering into a pre-diabetic range. But after
Hmm.
some time, it shoot up again 8.2. Right now, it is 8.2.
Yeah, it shoot up again because her body is not producing enough insulin. But please follow diaphyt diet, otherwise it will go to 10.5
Okay,
or
right,
more.
sir.
Okay,
Thank you, sir.
adjust
Thank
adjust the insulin.
Right. Okay, thank you, sir.
Okay,
Good day, sir.
all the best.